We have checked in on past global connections with Dr. Michael Drescher, who runs the emergency department at Rabin Medical Center in Petah Tikva in the greater Tel Aviv area in Israel, about Israel's experience of COVID-19. Mike Drescher, who divides his time between Petah Tikva and Hartford, Connecticut, joins us once again for a few minutes. And, the first time we spoke in the end of June, Israel was on top of this thing. As you told us, it played to Israel's natural strengths. It's a relatively small country, only one big airport, pretty secure borders. The next time we spoke, school had resumed and there were some outbreaks. Now it seems as though, your hospital is now taking overflow patients from Jerusalem hospitals, yes?
Yes, that's correct, Robert. We have opened up in two wards that are dedicated to COVID patients. One of the wards is in our parking garage. We have an underground garage underneath our emergency department. It's, of course, no longer a parking garage. It's been turned into a full-fledged hospital ward, which has been something to see. But yes, we have been taking from areas of the country which are harder hit in terms of the severity of illness and bringing them to Beilinson.
I mean, harder hit as in they don't have the hospital beds for them.
Correct. Well, harder hit in the sense of more ill people, but also in fewer beds per capita and per sick person.
The bad news about COVID-19 in Israel is that the number of cases have risen. The good news is your mortality rate in Israel seems to be quite low by our standards certainly by our standards in the States. Well,
the one thing that puts Israel in a bit of a different position is the general age of the population. We have probably the highest level of children per family in the Western world. So there's a lot more young people, and young people, as we know, in the era of COVID, are not as severely affected. They are infected, but they're not as severely ill by any means. And so we have a lot more infected people, but fewer fatalities as a result of that. A much younger population in general.
I mean, the biggest families in Israel tend to be Haredi families, very Orthodox families, and that appears to be where the greatest outbreaks have been in Haredi neighborhoods. Yes,
over the past few days, really, or weeks to days, we've been seeing a kind of a leveling. That is, the general population has become more infected, but it's still true that the hot spots have been generally in Haredi neighborhoods and also in some of the Arab areas perhaps for other reasons, but those really have been the outstanding neighborhoods or towns that have been affected.
I asked you this the first time we spoke, and I'll ask you for an update. Have you learned more about this disease since, in the past couple of months? Have Israeli doctors learned more that informs the way that they're treating people better?
Absolutely. The answer is yes. A lot of the burden on the medical system of this disease is the logistics of it. That is, there are people who are very ill who require intensive care, etc. But there are a lot of people who are not particularly ill, but the way in which they need to be dealt with in order to keep the disease from spreading requires a lot of logistics, requires, of course, personal protective equipment, requires isolation. We have every emergency department in the country, including ours in the Rabin Medical Center, has a separate wing for suspected people with COVID. Now, they don't all have COVID, so we need to keep people isolated one from the other. We have a separate area for people who have been identified as positive for the disease, but this all requires a whole new setup of patient flow and how we take care of patients. So, in addition to having intensive care, internal medicine wards for patients who are significantly ill, we also have the whole system needs to be set up for dealing with this, and we've learned to do it well. We've learned to take care of people. We have a significant number of staff who have been either in isolation or have gotten ill, but by and large, not from patients in the hospital, from the surrounding area, from families, schools, et cetera, like the rest of the population.
Well, Mike Drescher, Dr. Michael Drescher, head of the emergency department at the Rabin Medical Center, thanks.